Hello, I'm Dr. Rob Snyder. I'm professor and director of clinical research at Barry University and the past president of the Association for the Advancement of Wound Care. I'm here today to talk just briefly about diabetes and what we may see in the future. Diabetes obviously is a monumental problem, and by the year 2030, it's anticipated that there will be 550 million diabetics. There are now amputations occurring every 30 seconds somewhere in the world. And obviously, this is not only a significant medical problem, but a financial problem as well. This certainly could bankrupt some small countries relative to taking care of these individuals. So as far as what the future brings, obviously, we're looking for a cure for diabetes. But first and foremost, we have to educate the patient. We have to educate not only the patient, but the caregiver. And also the primary care doctor relative to diabetic foot ulcers. Diabetic foot ulcers clearly are as serious as some cancers. Certain technologies will be extremely important in the future. As an example, certain sensors can be utilized in an orthotic or some type of insert for a shoe, which may signal an individual, as an example, that they are putting an abnormal point of pressure on an area. Certainly, this could be very, very beneficial. Not only can it alert the patient, but also the patient's clinician as well. Another interesting and important thing that should develop over time is point-of-care diagnostic tests. This will clearly give us an opportunity to personalize care. Not only that, but also give us the ability to be able to treat patients at the point of care, not to necessarily have to wait for some significant tests. Stem cells, I think, will become much more significant in the future. Autologous therapies will become more and more important. The microbiome, I think, is also very, very interesting. I think the more we begin to learn about biofilm and about just bacteria in general and the importance of how this not only may hamper wound healing, but may ultimately help wound healing as well. So again, a whole host of things coming down the pike. Obviously, we're going to have to find a way to wrestle with the problem relating to antibiotic resistance. And this is certainly something that could also be catastrophic if it's not dealt with in a very short period of time. And I think as a government and also as a global initiative, I think we're all working towards that goal. So thank you very much for the opportunity to share some of my insights, and best of luck to you.